After years of debate over how to best serve North Carolinians whose medical needs are covered by the program called Medicaid, Governor Roy Cooper has now signed into law a bill sent to him by state legislators that will transform the Medicaid program, a transformation designed to improve the health of Medicaid patients and to save money as well. Jordan Roberts is following all of the issues related to Medicaid in North Carolina. He is the healthcare policy analyst for the Locke Foundation and joins me now. Jordan, welcome back to the show.
Thanks for having me.
Let's talk about the basis of the change to the program. It is going from a program that pays doctors and hospitals for each service that they provide to what?
Yeah, so what you just described is called a fee-for-service, and that's typically how we've paid healthcare providers. But now we're switching to a managed care model where the state will pay managed care organizations, private insurers, essentially, a per-member, per-month rate based on how many Medicaid enrollees they can get within their plan. And then that managed care company uses that per-member, per-month rate, how they see best fit to manage the care of these Medicaid enrollees and try to improve health outcomes and save money on the back end. And the way it works is we give this money to the managed care companies, and they have to spend a certain amount of it, and anything above that they can keep as profit, and anything below that they would have to spend on their own.
During the debate over this over the past, half dozen years or so, as we've talked about this here in North Carolina, there had been a concern by those who were opposed to this. They said, well, based on the description you just gave us, how do we ensure that a medical provider will be ethical and have the patient's best interests at heart if there's a profit motive? And tell us about that. How do we ensure that these folks are really going to be caring for people?
Right. So, I think the biggest thing is that there are oversight and safeguards built into these managed care contracts to make sure that the managed care companies are meeting all of their standards and metrics that they need to meet. So that's one thing.
So they can't just deny someone
exactly.
any sort of treatment.
It's certainly happened, but we're getting better at managing and overseeing these companies. But I think the biggest thing is that what this does is it essentially allows these statewide insurers to compete. And so if a Medicaid enrollee wasn't happy with the care they were getting with one company, there's 4 statewide companies that got a contract, and they're all essentially competing to provide the best care. So there's really an incentive to get as many Medicaid patients in your plan as possible, and you do that by providing good care, having the best network, and showing your Medicaid our Medicaid enrollees that your plan is the best. So there is that profit motive there, but that's how we ensure that we have good administration and good management of the plans. But so it just depends on how much how much these managed care companies are willing to do.
Jordan, this has been going on for so long. Give us a sense of how this started out. I know that during the Pat McCrory administration, they focused on trying to just shore up the Medicaid program because it was constantly over budget.
Yeah.
Is that what really started the discussion about, hey, maybe there's a better way to operate this?
Yeah, I think so. So the McCrory administration, a little bit before my time with the Locke Foundation, but during that time, the state was suffering from a lot of Medicaid budget shortfalls. We were spending way more than we had anticipated, and that was causing problems in the budget. But so that was one reason. But I think the other reason mainly is that the majority of states have switched to this managed care model just to kind of get the state out of this risk-bearing position with the Medicaid patients, because it's a tough population of unique health needs to manage. And so getting this handing that risk over to managed care companies that are experienced in this and have vast networks and understand how to manage the care of these folks can be a much more prosperous arrangement for both the state and the patients. So the Medicaid budget shortfalls and just kind of the need for the state to get out of this business and still provide that care, but allow people who are more specialized in this to handle it.
Tell us a little bit more about the folks who are covered by Medicaid. And sometimes people get confused between Medicaid and Medicare.
Right.
Medicare being the government program for people over the age of 65, but Medicaid is much, much different.
Right. So these are going to be, the neediest populations in our state. These are poor children, mothers, the elderly, blind, and some disabled folks. So these are really the people that are most in need of assistance from the state, and so those are the populations that are going to be in this managed care arrangement. Not all of the about 2.2 million Medicaid enrollees will go into managed care. About 1.6 of the total will. That other remaining portion will still remain in fee-for-service, just for reasons that we don't need to get into here, but it's the majority of the Medicaid patients, and so these are the most needy and at-risk populations in our state.
I ask you that because it has become really important to the discussion of a related but different issue in North Carolina. The people who are covered by Medicaid, as you described, folks who really need help. They're living on the margins for one reason or another. There's been a lot of talk about, North Carolina should expand the population that is allowed to be covered by Medicaid. The John Locke Foundation, and you in particular, have been writing a lot about this over the last couple of years. North Carolina has not expanded Medicaid as it could under Obamacare. Tell us why not.
The main reason why I think myself and a lot of people in the legislature have been against this policy is just the vast expansion of government health care. We provide this service to the neediest populations because that's what we should do, and we should help these folks. But there has to be a cutoff, a limit, and the Affordable Care Act allowed us to expand up to 138% of the federal poverty line, and so what we believe is that there are other solutions that we can use to help these folks that are uninsured or struggle to afford their current health insurance, to help them get that without expanding the government scope of healthcare. And so this Medicaid transformation, very different than Medicaid expansion. This was some of the political back and forth. Those on the left said we should expand Medicaid, and those on the right said we should move it to a managed care organization. But very very different populations, and we want to provide for the neediest in our state, and Medicaid transformation, getting it into a managed care is one way that we could possibly do that.
Yeah, two different issues, but I think it's so fascinating about how the discussion has kind of overlapped at times about that. Governor Roy Cooper is a big proponent of adding 500 to 600,000 more people to the Medicaid rolls. And you've written eloquently, Jordan, about the profile of those people that would be added. Many of them would have many other options, able-bodied working people.
That's right, yeah. And so, that's why it was interesting to see Governor Cooper sign this, because that was his biggest sticking point, was that, saying to Republicans at the legislature, if you guys want your Medicaid transformation, your privatization of Medicaid, then you're going to have to expand it for me. And, that was interesting to see play out, and I'm glad the governor signed that bill so we can get this going.